The National Center for Health Statistics, or NCHS, is one of the centers of the Centers for Disease Control and Prevention. The primary mission of the National Center for Health Statistics is the collection and dissemination of health statistics for the nation. The National Health and Nutrition Examination Survey, or the NHANES, is one of many data collection systems at NCHS. This particular survey is unique among national health surveys. It collects nationally representative reference data through household interviews and detailed physical examinations. These examinations are conducted in specially equipped mobile examination centers that travel to selected locations across the United States. The third NHANES, a 6-year survey conducted from 1988 through 1994, was designed to provide reference health and nutritional status data for the U.S. population and detailed statistics representing non-Hispanic white, non-Hispanic black, and Mexican American persons in all 50 states. NCHS makes available reports of reference health data as well as public use data sets for others to analyze. Many researchers and healthcare providers compare information collected in their local clinics or research projects with these nationally representative reference data. Consequently, a considerable amount of interest has been expressed by investigators and healthcare professionals in the methods used to collect the NHANES data. One of the physical exam components included in the NHANES that receives particular attention from numerous data users is the anthropometric, or body measurement component. In the scientific and medical literature, many different approaches to measure the human body have been documented. Variations in assessment methodologies can affect interpretations when comparing locally collected data with national reference data. Therefore, it's important to use standardized procedures consistently. This video production demonstrates the anthropometric procedures used to obtain body measurement reference data for the third National Health and Nutrition Examination Survey. It's intended to share with others the specific procedures selected and used for the anthropometric assessment. The viewer should have a basic knowledge of the fundamentals of anthropometry. For further background information on the underlying principles of anthropometry, as well as distributors of measuring equipment, a reference, such as the Anthropometric Standardization Reference Manual, is recommended. This demonstration of procedures will allow others to follow the NHANES 3 anthropometric methodology and will enable the comparisons of data from other studies with national reference data. The first measurement taken is body weight. In the NHANES 3, an electronic load cell scale was used to record weight. The following guidelines are used for clothing. Infants wear only a clean diaper. Children and adults wear only their undershorts and a disposable paper examination gown with paper pants and foam slippers. For infants and toddlers who cannot stand unassisted, a parent or technician stands alone on the scale platform. Next, the scale is tiered or set to 0. The infant or toddler is then held by the person on the scale to obtain only the child's weight. Holding the child provides greater security and reduces movement that might otherwise affect the accuracy of the measure. Older children and adults are instructed to stand completely still in the center of the scale platform, with the feet close together, hands at the sides, and looking straight ahead. The weight measurement is taken from the electronic readout and is recorded in kilograms to 2 decimal places. The standing height or stature measurement is an assessment of maximal vertical size. This measure is for persons who are able to stand unassisted. The analogous measure for children less than 3 years of age is recumbent length. Standing height is measured with a fixed stadiometer, with a vertical backboard, a fixed floorboard, and a movable headboard. Hair ornaments, jewelry, buns, braids, and cornrows should be moved or removed from the top of the head in order to measure stature properly. The person stands on the floorboard with the heels of both feet together touching the base of the vertical board. The toes are pointed slightly outward at approximately a 60-degree angle. Body weight is evenly distributed, with both feet flat on the floor. The technician checks the position of several points of body contact with the vertical board. The first contact point is the heels, followed by the buttocks, the scapula or shoulder blades, and finally the back of the head. Depending upon the overall body conformation of the individual, all points may not touch. In such case, the trunk of the body should be positioned vertically above the waist with the arms and shoulders relaxed. The head should be aligned in the Frankfurt horizontal plane. The head is in the Frankfurt plane when the horizontal line from the ear canal to the lower border of the orbit of the eye is parallel to the floor and perpendicular to the vertical backboard. Many people will assume this position naturally, but for some it may be necessary to make a minor adjustment. If required, the technician may gently tilt the head up or down until proper alignment is achieved, with the eyes looking straight ahead. Once correctly positioned, the headboard is lowered, and the person is instructed to take a deep breath and stand as tall as possible. A deep breath allows the spine to straighten, yielding a more consistent and reproducible stature measurement. The headboard is positioned firmly on top of the head with sufficient pressure to compress the hair. The measurement is read in centimeters and recorded to the nearest millimeter. The person then relaxes and steps away from the stadiometer. Some people may have conditions that will interfere with the specific procedures for measuring stature. One of the more common conditions encountered is kyphosis. Kyphosis is a forward curvature of the spine that appears as a humped or crooked back condition. Kyphosis most frequently occurs in the elderly, where the condition is commonly referred to as dowager's hump in women. In these cases, it's important to get the best measure possible according to the protocol. It's also important to make a notation of the person's condition. A recumbent length measurement is taken on children ages 3 years and younger. The equipment used for this measure is a device with a fixed headpiece, a horizontal back piece, and a movable foot piece. Placing infants and small children in a recumbent position frequently generates a sense of insecurity and consequently invokes a crying response. When measuring recumbent length, the parent or other caretaker of the child is positioned in the middle between the technician and the assistant. The parent encourages and comforts the child by making eye contact, talking to, and if necessary, holding the hands of a restless child. The assistant supports the child's head. Similar to the procedure for standing height, the child's head is positioned in the Frankfurt plane. Gentle traction is applied to bring the top of the head into contact with the fixed headpiece. The child's head must be firmly held in this position by gently cupping the palms of the hands over the ears and holding the head in proper alignment. Simultaneously, the technician aligns the child's legs by placing one hand gently but firmly over the knees. The toes point directly upward, with the soles of the feet perpendicular to the horizontal back piece of the measuring device. Gentle pressure is applied at the knees to keep the legs straight. The technician then slides the movable foot piece to rest firmly against the child's heels. As quickly as possible, the measurement is recorded in centimeters from the measuring indicator to the nearest millimeter. Sitting height is a measure of the trunk of the body from the buttocks to the top of the head when the subject is sitting upright. To record this measure, the stadiometer and a specially constructed box of a known height are used. The subject sits on the box with the posterior aspect of the buttocks, the shoulder blades, and the back of the head touching the vertical backboard of the stadiometer. Similar to the procedure followed for standing height, the head is positioned in the Frankfurt plane. The subject is instructed to take in a deep breath and sit up as tall as possible. The headpiece of the stadiometer is lowered to the top of the head, and the hair is compressed. The reading is taken to the nearest millimeter. To reliably measure circumferences and skin folds on the limbs, the upper arm and leg lengths must first be measured and their respective midpoints located and marked. For upper leg length, the subject sits on the measuring table. The lower part of the right leg hangs freely over the edge of the table, and the right knee is positioned at a 90-degree angle. The small sliding caliper is positioned firmly against the distal end of the femur on both sides of the patella, as if one were to measure the breadth of the patella. The horizontal bar of the caliper should be touching the anterior surface of the thigh. It's at the lower border of the horizontal bar of the caliper, proximal to the patella, that a line is drawn with a waxed-base cosmetic pencil. The zero end of a steel measuring tape is placed at the inguinal crease, just below the anterior superior iliac spine. The measuring tape is then extended along the anterior midline of the thigh to the mark that was previously made just proximal to the patella. To check for proper location of the zero end, the technician should firmly place the middle finger over the measuring tape at this site and instruct the subject to raise the thigh slightly. If positioned correctly, a tightening of the muscle tendon will be clearly felt. To obtain the upper leg length, the reading is taken from the measuring tape to the nearest millimeter. This distance is divided by 2, which indicates the midpoint of the thigh. A mark is made on the skin at this midpoint before the measuring tape is removed. This mark is then crossed with another mark that extends on a line between the anterior superior iliac spine and the middle of the patella. This point defines the site at which both the mid-thigh circumference and mid-thigh skin fold are measured. To locate the middle of the upper arm, the subject stands with the right arm flexed 90 degrees at the elbow. The palm faces up, and the fingertips point straight ahead. The technician stands behind the subject. The uppermost edge of the posterior border of the acromial process is located on the right scapula, and a horizontal line is drawn at this point. The zero end of a steel measuring tape is held on this mark. The tape is extended down the midline on the posterior surface of the arm to the tip of the olecranon process at the elbow. The distance between the mark at the acromion and the tip of the olecranon is divided by 2. A horizontal mark is made at the midpoint on the posterior aspect of the arm before the measuring tape is removed. This mark is then crossed with another mark that lies in a plane extending from the acromion to the olecranon. This point defines the site at which both the mid-upper arm circumference and the triceps skin fold are measured. Knee height is measured only on adults aged 60 years or older. The person sits upright on the measuring table with both legs hanging freely over the edge of the table. The technician places the fixed blade of the large sliding caliper under the heel of the right foot, just below the lateral malleolus of the fibula. The right foot is held in the palm of the technician's right hand. The technician raises the subject's leg slightly so the knee and the ankle are both positioned at a 90-degree angle. The movable blade of the caliper is placed on the anterior surface of the right thigh, above the condyles of the femur, approximately 3 to 4 centimeters, proximal to the line previously marked on the upper border of the patella. The shaft of the caliper is held parallel to the shaft of the tibia. The caliper shaft passes over the lateral malleolus of the fibula at the ankle and just posterior to the head of the fibula at the knee. Firm but gentle pressure is applied to the caliper blades to compress the soft tissues on the heel and thigh. The reading is recorded in centimeters to the nearest millimeter. Arm circumference is measured with the subject standing and with the right arm hanging loosely and relaxed. It's important to be certain that the muscle of the arm is not flexed or tightened, which could yield a larger and inaccurate reading. The technician stands to the right side of the subject and places a steel measuring tape around the upper arm perpendicular to the long axis of the arm at the marked point. This mark was made previously when the upper arm length was recorded. The measuring tape is held gently on the skin surface. The two ends of the overlapping tape are pulled together, using care not to compress the skin and the underlying subcutaneous tissue. The arm circumference is recorded from the measuring tape on the lateral aspect of the arm to the nearest millimeter. To define the level at which the waist or abdominal circumference is measured, a bony landmark is first located and marked. The subject stands, and the technician, positioned to the right of the subject, palpates the upper hip bone to locate the right ilium. Just above the uppermost lateral border of the right ilium, a horizontal mark is drawn, and then crossed with a vertical mark on the mid-axillary line. The technician places the measuring tape around the trunk at the level of the mark on the right side. The technician then inspects all sides to make sure the measuring tape is in a level horizontal plane. Mirrors on the wall are used to assure correct horizontal alignment of the steel measuring tape. This is especially helpful for women with hourglass-shaped torsos and for overweight subjects. The tape is then tightened slightly without compressing the skin and underlying subcutaneous tissues. The measure is recorded in centimeters to the nearest millimeter. The subject is instructed to stand upright, with feet together and weight evenly distributed. The buttocks or hip circumference is the only measure that is not taken directly on the skin. The assistant technician stands in front of the subject and gathers the fabric of the pants. The thumbs and index fingers hold the folded sides of the pants snugly. This minimizes the amount of material included in the measurement and helps to define the maximum protuberance of the buttocks when viewed in profile. The technician is positioned on the right side with eye level at the hip region of the subject. The steel measuring tape is placed around the hips and anchored at the maximum protuberance of the buttocks. The assistant then releases the folds of the pants and helps to adjust the tape so that it's in a horizontal plane. The measuring tape is held snugly but not pulled tight, and the measure is recorded in centimeters to the nearest millimeter. For thigh circumference, a standardized position is required. The technician best explains it to the subject through combined demonstration and instruction. The subject is instructed to step back with the left foot. This shifts the body weight to the left leg. The right leg is in front and bent slightly at the knee. The soles of both feet are flat on the floor. The right forward foot is used mainly to assist with balance, but should not bear the weight of the body. The technician, positioned to the right of the subject, places the measuring tape around the thigh at the midpoint previously marked for upper leg length. The measuring tape is positioned on the skin, perpendicular to the long axis of the thigh. The two ends of the overlapping tape are pulled together, using care not to compress the skin and the underlying subcutaneous tissue. The thigh circumference measurement is recorded in centimeters to the nearest millimeter. Prior to measuring the skin folds, each site is carefully marked on the right side of the body using either bony landmarks on the trunk or midpoints between well-defined bones on the limbs. For each site, the skin fold is lifted up at a location 2 centimeters, or approximately 3/4 of an inch, above the point at which the caliper tips will be placed. The thumb and index fingers separate the subcutaneous fat from the underlying muscle. Just enough skin and adipose tissue is taken up to form a distinct fold. The jaws of the calipers are placed perpendicular to the length of the fold, while the technician continues to hold the skin fold. The actual measurement is read from the caliper dial 3 seconds after the caliper tips are applied to the skin, and the tension is released from the caliper handle. The skin fold thickness is measured in millimeters to the nearest tenth of a millimeter. On some individuals, it's not possible to separate the fat from the muscle tissue. When a distinct fold of skin and subcutaneous fat cannot be made with confidence, an appropriate note should be entered on the data recording form, and a measurement value should not be recorded. The thigh skin fold is measured on the right thigh at the point previously marked for the thigh circumference. Following the same procedure used in positioning the subject for thigh circumference, the subject stands with most of the weight on the left leg, with the right leg forward, knees slightly flexed, and the soles of both feet flat on the floor. The skin fold is taken up in the midline of the thigh, with the measuring technician's fingers centered just above the mark. The tips of the caliper jaws are placed perpendicular to the length of the fold, 2 centimeters from the fingertips, and centered over the marked point. The triceps skin fold is measured on the right upper arm, at the point previously marked for the mid-upper arm circumference. The subject stands upright, with feet together, shoulders relaxed, and the arms hanging loosely at the sides. The technician stands behind the subject and gently lifts the triceps skin fold, with fingertips centered just above the mark. The triceps skin fold is held parallel to the long axis of the upper arm. The tips of the caliper jaws are placed perpendicular to the length of the fold, 2 centimeters from the fingertips, and centered over the marked point. The subscapular skin fold is measured with the subject standing upright, shoulders relaxed, and arms hanging loosely at the sides. The technician stands behind and gently palpates the inferior angle of the right scapula, which is to say the lowermost tip of the triangular bone. A mark is made on the inferior angle of the scapula. The technician gently lifts a fold of skin and subcutaneous adipose tissue with the index finger directly above and medial to the mark at the inferior angle of the scapula, and with the thumb reaching toward the spine. The skin fold forms a line extending diagonally toward the right elbow. The jaws of the caliper are placed perpendicular to the length of the fold, 2 centimeters from the fingertips, with the tip of the top caliper jaw directly on the mark at the inferior angle of the scapula. The suprailiac skin fold is measured at a point anterior to the mark previously made to measure waist circumference. The subject stands in an upright position with weight evenly distributed and feet together. The examination gown is held so that the waist area on the right side is exposed. The technician's thumb is placed on the intersecting marks, and the index finger is placed above and anterior to the mark. The skin fold slopes downward at approximately a 45-degree angle toward the pubic symphysis. The tips of the caliper jaws are placed approximately 2 centimeters below the fingertips. For the biacromial breadth measurement, the subject sits upright with a noticeable curvature in the lower back. The shoulders are relaxed, with the hands resting on the lap. The technician stands behind the subject. The shaft of the broad blade caliper rests at the base of the thumb and index finger of both hands. The technician uses the middle fingers to palpate the ridges of the acromial processes. When the lateral borders of the acromial processes are located, the bars of the sliding caliper are placed directly on them. The shaft of the caliper is aligned parallel to the shoulders. Pressure is applied to compress the soft tissue without inducing pain. The maximal breadth across the lateral borders of the acromial processes is measured in centimeters to the nearest millimeter. Biiliac breadth is taken while the subject is standing upright with the feet together and the waist area exposed. The technician stands behind the subject, resting the large sliding caliper between the thumb and index finger of each hand. Using the middle fingers, the uppermost lateral borders of each ilium on the mid-axillary line are located on both sides of the body. The arms of the sliding caliper are placed on the lateral borders of the ilium, and the soft tissue is compressed firmly. The maximum breadth is measured to the nearest millimeter. For elbow breadth, the subject stands facing the technician. The right arm is extended forward and is flexed, so the upper arm and forearm form a 90-degree angle at the elbow. The fingers point up, with the posterior part of the wrist toward the technician. While holding the caliper between the thumb and index finger of each hand, the technician palpates the epicondyles of the elbow with the middle fingers. The blades of the caliper are applied to the epicondyles at a 45-degree angle to the plane of the long axis of the upper arm. The soft tissue is compressed firmly. This measurement is taken with the calipers at a slight angle because the medial epicondyle is slightly more distal than the lateral epicondyle. The greatest breadth across the epicondyles of the humerus is measured to the nearest millimeter. The wrist breadth is measured with the subject standing. The subject extends the right arm directly to the front, with the palm of the hand down. The small sliding caliper is held between the thumb and index finger of each hand. The technician palpates the most prominent aspects of the styloid processes of the ulna and radius with the middle fingers. The caliper blades are placed on these landmarks, and firm pressure is applied to compress the soft tissues. The wrist breadth is recorded to the nearest millimeter. A head circumference measurement is taken on children ages 2 months through 7 years. A plasticized insertion tape is used to measure head circumference. The infant is held on the lap of the parent or assistant technician. Older children may sit or stand unassisted. Any hair ornaments or any hair arrangements, such as braids, that may interfere with the accuracy of the measure should be removed. The technician stands to the right side of the child. The insertion tape is placed around the head. On the face, the lower margin of the measuring tape is placed just above the eyebrows. On the sides of the head, the tape extends above the ears to the back of the skull, where it's centered over the occipital prominence. While holding the tape in place over the eyebrows, the tape is moved up or down as necessary on the posterior aspect of the skull. The objective is to locate the maximal circumference of the head at the occipital prominence. The enlarged portion of the measuring tape that contains the window where the reading is taken should be laid flat on the side of the head. The two ends of the measuring tape should be pulled firmly to compress the hair and the underlying soft tissues. The measurement is recorded to the nearest millimeter. To assure valid, reliable, and comparable data, it's important for all technicians to perform all anthropometric measurements in a standardized fashion, relying on the techniques, procedures, and methods as presented in this program. The National Center for Health Statistics hopes that these standardized procedures for measuring and recording body dimensions will provide valuable medical and scientific information that will lead to a better understanding of the human body.